Well, it's the top disease-related killer of pets, but a cancer diagnosis does not have to equal a death sentence for your four-legged friend.
And joining us now is Dr. Mackenzie. He is a board-certified specialist in surgery at Affiliated Veterinary Specialists. So for those who might not, welcome, by the way. Thanks
Thank you for having me.
So those who might not know much about Affiliated Veterinary Specialists, what really sets your team apart from other animal hospitals?
Well, here in Jacksonville, we're a group of 4 board-certified surgeons, which means we not only went to veterinary school, but we did internships, residencies, and have advanced training in surgery. And we basically work with your veterinarian synergistically to better serve your patient or your pet. And so our job is to help your veterinarian treat dogs and cats with surgery. Affiliated Veterinary Specialist has the longest tenure here in the city with over 20 years of experience in the city itself.
And it's really about the complex issues with your pet. It's not just, oh, we got to go get the vaccines and things like that. It's
Correct.
Come to you guys.
Our job is to work with your veterinarian to offer specialized surgical skills that may be a little bit above what they can handle.
And talk about your role with the hospital.
Well, I'm one of the chief medical officers of the hospital. I'm a board-certified surgeon. Basically, we do surgeries from orthopedics, soft tissue to neurosurgery at our hospitals.
And also cancer is one thing that you see, I'm sure, a lot of dogs and cats coming through.
Yes.
It's a tough thing. I had a dog that passed from cancer. It's hard. So what do you think are some of the most common forms of cancer that you're seeing in your practice?
Well, a lot of the surgeries that we do are associated with masses. Now, the masses can be on the skin, or they can be in the abdomen or the thorax, and I think abdominal tumors are probably the most common that we see. And a lot of people are nervous when they hear that their dog has cancer because, okay, they're going to pass away from this cancer, and it's not the case. I mean, with the advancements in medicine and surgery, our patients are living longer, therefore a lot of them are getting diagnosed with cancer, but it's our job to extend their quality and quantity of life. And we have the ability to do that, and so it's not a death sentence when their veterinarian tells them they have cancer. We have a lot of options, and we work closely with board-certified oncologists in town to help their patient or their pets live longer. And
so, obviously, I mean, I think everybody has also been touched by this as well with their animals. I had a dog that had it, and you could see the lumps, and you could feel it. And when you can feel it, it's very easy to be like, I think there's something wrong here. But what about when you can't see a tumor or whatever? What are the symptoms you should look for?
Well, you know, a lot of people, like you said, you found the lumps and bumps, and everybody pets their dogs and cats, and they can find those. But pets that come off of their food, or they may start coughing because they have a mass in their chest. Cancer in the abdomen can cause different things. It can cause them to vomit. It can cause them to breathe heavy. And so when you see something off on your pet they don't want to eat, you take them to your veterinarian. So it's a good plan to do preventative medicine. Get your pet to the veterinarian twice a year to have them evaluated, because a lot of masses can be found early, and the smaller they are, the better they are for surgery.
The smaller they are, the smaller the
tumor is.
Okay,
yes,
right,
yes.
then they are. Okay, what can a homeowner, a pet owner who wants to come in and see you, what can they expect when they walk in the door? Some of the cancer procedures and treatments that you have to offer for the various types of cancer you're treating?
Sure. Usually we'll do a staging process where if we find a mass in the abdomen, we'll probably recommend taking x-rays of the chest, or if we find cancer outside the body, we may recommend an abdominal ultrasound, or these are things that have already been performed by your veterinarian. And so we just want to make sure we have the full picture together so we know how to put a treatment plan. Like I said, we work with the board-certified oncologist here in town as well, and so it's a group effort towards taking the best care of your pet and giving them not only a quantity of life, but always giving them that quality of life as well.
And you're in such a unique position to help people through really traumatic times with a pet that they love, and so there has to be some cases that are obviously, you know, all of them are extremely important to you, but there has to be some memorable cases.
Sure. Well, one of the recent ones is a dog named Bogart. He's an older Labrador, and he had a large mass in his chest. And before, and you can see on the image there, the mass is up in front of the heart, and the mass is actually larger than his heart. And we were able to remove that mass. Bogart's now 6 months out from surgery. He's cancer-free. He's back hiking with the owner, going out to the beach and running and playing. So even though you hear cancer, these dogs still have a very good quality and quantity of life long term.
Bless his little heart, no pun intended.
Oh, yes, exactly.
Well, that's good to hear. All right. Well, thank you so much for being here.
Thank you for having me.
We appreciate your time, and we'd like to thank Affiliated Veterinary Specialists for sponsoring this segment. And for more information, you can visit them at avspethospitals.com. You can also call the Jacksonville location. The number is 904-646-1287. The Orange Park location, that number is also on your screen, 904-278-0287.